Well, good afternoon. Welcome everyone to our virtual Compassion in Action Healthcare Conference. We are very happy that you've chosen to spend your Friday afternoon with us. And we have a really terrific session today. I think you'll enjoy it. Please welcome with me Dr. Noopur Raje, a researcher and an oncologist at MGH Cancer Center. She's the director of the Center for Multiple Myeloma at MGH and professor of medicine at Harvard Medical School, and also her husband, Dr. Singh, who is clinical director of the cardiology division and Roman de Sanctis Endowed Chair in Cardiology, also the founding director of, this is a mouthful, the Resynchronization and Advanced Cardiac Therapeutics Program at MGH, and also a professor of medicine at Harvard Medical School. So Noopur and Jag, thank you so very, very much for joining us today.
Thanks for having us, Beth.
Our pleasure, Beth. Thank you.
Yeah, I heard about your experiences with COVID-19 as I was sitting in on a virtual Schwartz rounds at the MGH Cancer Center. So I learned a little bit about your experiences. It was around the time the surge was just revving up, I think, in Boston earlier this year, around March, I think. And I just thought it'd be really interesting to share a little bit about what it was like to be a clinician, a parent, a patient, a family caregiver. So we'll go into all of that, but I wonder if you could just start out by telling us a little bit about yourselves and what drew you to your work and what you truly love about it. Noopur, why don't you start?
Sure. So first of all, thank you for having us, Beth. It's been a while since we had this experience, but, it still is something which I don't think I'm ever going to completely get over or completely ever forget. There's a lot of things we've learned along the way. I am a medical oncologist, as you pointed out. I work at the MGH Cancer Center. I work on bone marrow related cancer, multiple myeloma. I direct the myeloma program here, and I do basic science as well. So I do have a lab, and I've been a physician for more than half my life, and I can't think of doing anything other than being a doctor. Part of what really wakes me up in the morning every day is, the connection with patients and the stuff that we do in the lab. So my lab is a fairly translational lab. We do a lot of work around trying to understand the disease and trying to get novel treatments for the disease. It is an incurable cancer, so having that lab really keeps us motivated on trying to do better and bigger things so that this disease, at some point, we can call it a curable disease. So that's really what really charges me up every day.
Thank you, Noopur. Actually, I've seen you on television in the ad for Mass General Cancer Center. And Jag, how about you?
Thanks, Beth. So once again, I want to echo Noopur's sentiments. Thank you for having us. I think I'm an oncologist wannabe. No, just kidding. So I am a cardiac electrophysiologist by trade. So I introduce myself to patients as an electrician. I deal with heart rhythm disturbances. I fix it by either implanting devices or by putting catheters in and burning some circuits to take care of the rhythm disturbances. I love it. I love cardiac electrophysiology. I've always been, I would say, taken up by the physiology of cardiovascular medicine and the opportunity to kind of look after patients on a day-to-day basis and touch their lives and allow our lives to be touched by them. I think it's just a phenomenal privilege to have. I also, being at Mass General, dabble in research. I'm a clinical trialist and run about 5 international clinical trials at this point in time. But over and above, beyond that, I think just having the opportunity to look after patients, interface with our colleagues, and continue to be involved in education and research is very fulfilling.
It's a lot of roles, a lot of work, and you have family, you have children. Am I right?
We
You
do. We
have
do.
2 children. They're grown though.
They're grown out of the house.
They're both out of the house.
Okay. So I just wonder, here you are immersed in your work, and then COVID comes along. Well, can you just tell us a little bit about what happened and what your experience was like early on and then over time?
Sure, no, happy to do that. So, I think this all seems so distant now because I was probably amongst the earlier ones to get infected. This was, to be precise on the date, was March 11th when I actually, developed the fever. Just to give a little backdrop, prior to that, I had been traveling, but it was all domestic travel. I'd just given a couple of lectures that weekend before in Chicago. Came back, spent the day in doing procedures, and then the day after that in clinic. And at the end of the clinic, when I was going home, I felt a little poorly. And the next morning, I woke up with a fever and body ache. I almost kind of instantly knew that something was amiss. It looked and felt very different from a conventional flu. And then I mentioned to Noopur that I probably have COVID. So Noopur herself got quarantined just on the suspicion that, we were dealing with COVID out here. Insisted on getting tested. It was so early at that point in time that there were even no directives from the hospital of not traveling, or they were just about coming out at that point in time. So I got tested on Friday the 13th. I remember quite distinctly. And I was COVID positive. Stayed at home for the next 7 days until the 20th, thinking that I was getting better. Still had the fever, still had the body ache. I probably was a little obtunded, which Noopur tells me anyway, most of the times that I am. But nevertheless, I think I thought I was getting better, but on the 20th, I started getting a headache. The fevers were still there. A little bit of shortness of breath and a cough started developing at that point in time. And Noopur felt that the better part of valor now, since we've been down with this for almost 10 days, was to actually go to MGH and get checked out. I was quite weak. We live in a townhouse just across actually from the hospital, and could not come down the stairs. So Noopur called 911, got me to hospital. In the hospital, long story short, I was in the ER when chest X-rays showed pretty evidently that I had significant infiltrative disease of both my lungs, which I had the opportunity to take a look at from the side on the X-ray screen. And following that, it was early days of COVID and folks were not exactly sure as to what the treatment strategies were, still kind of evolving. And since the X-ray looked bad, I then had a CT of my lungs, chest, and that showed that they did look bad. And I was then triaged to the ICU just on, considering that I might require ventilator support and intubation that night. Fortunately enough, I did well. My oxygen saturation stayed reasonably stable, and after staying in the ICU overnight, they felt that maybe I could just be managed conservatively on the regular COVID floor, which is where I went to. I stayed there for almost another 8 to 10, I think about 9 days before I got discharged because the fevers continued and the blood markers were going in the wrong direction for a period of time. But nevertheless got better and then subsequently went home on the 29th or 30th of March. So it was almost a 3-week saga from the start of the infection.
Yeah. And I remember, Noopur, if you wanted to sort of pick up the story of what it was like to watch Jag getting sick, because I remember how frightening that was for you from the previous discussions we've had.
Sure. So, as Jag pointed out, the first week when he talked about his fever And we knew early on because of him having gotten tested early on that it was COVID, and he was COVID-19 positive. So that was within 2 or 3 days. And the first week, I was fairly comfortable watching him and taking care of him because if you remember at the time, Beth, uh, I don't think a lot of was known about COVID, and most people said it's going to be like the flu. You've got to self-isolate and you're going to be okay. Hydrate yourself, fluids, and so on and so forth. And essentially, we were doing that. He was eating, he was drinking. He had lost a considerable amount of weight, and he had the first week he had I close to 12 or 13 pounds of a weight loss. So
Yeah.
that was different. And even so, what I think 3 or 4 days into it, when his fevers were not going away, I did get myself a blood pressure cuff and was trying to monitor sort of his signs. And they seemed stable, except for the fact that we constantly had to be on medication for fevers. At that time, I remember there was this whole issue of not using ibuprofen, and I used to try and not give him the ibuprofen because I didn't want things getting worse. So week one was okay. I think what was to me scary was 8 or 9 days into it when he started coughing. I don't know if he was really short of breath, but it was mostly that dry cough, which was really concerning to me. And that's when I actually called folks at MGH and said, at least I want a chest x-ray and at least want some baseline blood work to see which way things are going. And I remember the day, folks at MGH were fantastic. They had obviously told me, bring him in. And I remember I had driven the car up front in front of our house, and I said, I'm going to drive him into the hospital. But as the day progressed, I couldn't get him down. And it so happened that, my colleague who was waiting at MGH calls me and says, Noopur, when are you bringing Jag in? I say, I can't. It's going to be a couple of hours. And that's when I realized it's stupid me trying to bring him in by, drive him over. And I actually called 911 and got the ambulance. And I'm so glad I did that because by doing so, we were able to triage him to the emergency room. He got the testing he needed in terms of the chest x-ray and then the CAT scan. And it was not until then that I realized, when I looked at his blood markers, when I looked at his chest x-ray, that really how sick he was. And, it was a good thing we brought him into the hospital then.
Yeah. What was it like to look at your x-ray, Jack?
Not good, not good.
I can only imagine.
Yeah, I know. It's it's different looking at it from a different vantage point, right, from the other side of the bed. When I saw the x-ray, actually the x-ray was shown to me, said, this is what your lung looks, it doesn't look too good. Everyone trying to be objective to me because I'm a clinician, and, they felt that I needed to know. I probably didn't want to at that point in time, but nevertheless, I saw the x-ray didn't look good. There onwards, also, while I was in the ER, I was asked, a couple of times whether I was getting tired, more than a couple of times, whether I was getting tired breathing. And if I was, I just had to tell them, and they would arrange for me to get intubated. And I didn't necessarily want to be making that decision at that point in time. But, at the same time, I think it was, I think everybody was trying to involve me in the decision-making process to some extent. It's tough being a physician and a patient, or having a patient as a physician, right? So that was interesting. And then, fortunately, my oxygen saturations were stable, so it was a moot point in the end, and I was one of the few lucky ones who didn't progress.
Yeah, I wanted to invite, by the way, I wanted to mention this, anybody who's listening in, please enter some questions in the questions and answer little bubble there. We're more than happy to direct them to Noopur and Jag, so please do that. Also, you can enter any comments into the chat pane as well if you like, but click Q&A, just put them in there so we can make sure we answer your questions. I do want to ask you about this issue of sort of being on both sides of the equation. So it's difficult when people know your role and they want to respect your role and start asking you for advice on your own case. It's a very strange position to be in. And, on the one hand, I'm sure it emerges from wonderful motivation of wanting to be inclusive and, shared decision making and so forth. On the other hand, when you're really, really sick, kind of really don't want to be in that position. So how did you wind up thinking about it? And more importantly, how did you actually deal with that with your colleagues?
I didn't make much of it at that point in time, and I still don't. I think, they were really caring and wanted to care and were hoping to do the best they could at that point in time. And so it wasn't in any ways like passing the buck and putting the decision on you and not on, us or them. I think, it was all for the good, and there was, and I think it was the early stages of COVID that really there was so much of uncertainty as what the right next step is, even amongst, I think, clinicians as a whole. So if you come to think of it, I got hydroxychloroquine and azithromycin, which is now not a part of the protocol. And the treatment strategies have evolved over time. And I think, nobody knew when the right time to intubate was. In fact, early on, I think folks felt that, ventilation was probably the solution for people who were developing respiratory complications. And the earlier you put them on ventilators, the better they would do. And only have we learned later on that that's probably the wrong way of looking at things. The longer you keep them off the ventilator, they probably recover on their own, which was the case with me. So I think, I think it was all around the uncertainty of the disease and of the treatment strategies available at that point in time.
Yeah, it has been such an unfolding story, hasn't it? Just a lot of uncertainty in the best approach to treat it, how it spread, all kinds of things. Noopur, do you want to say a little bit more about what then it was like to have him in the hospital? What were you doing? How were you coping? I'm sure it was anxiety producing for everybody.
Sure. So again, I do want to highlight the fact that, there's so much of unknown about this disease, and we're learning about it as we go along. So the biggest thing for me as a wife, a physician, a mother, first a wife, obviously it's distressing to watch your husband go through what he is going through. And, you kind of know stuff, so you can understand what a sed rate means. You can understand what a CRP looks like. But when you see it really skyrocket, that is concerning. When you talk to your colleagues, and our colleagues were wonderful at trying to keep us informed, but that feeling of not knowing what to do next was, I think, probably one of the most anxiety provoking. And, as soon as Jag was hospitalized, because of the issues around COVID, I was not able to see him. He was in the hospital, and the only sort of connection I had with him was on FaceTime. I could obviously follow his labs along, but I remember whenever we FaceTimed, he used to look to me to see what the labs looked like. And after a point, I started telling him, don't bother with the labs. Let's look at how you're feeling. And if you're feeling good, we're just going to go with that. Right. So there was a tremendous amount of uncertainty. And I think the other anxiety-provoking feature was the isolation, the terrible, terrible isolation which COVID patients face. One is he's on his own, completely alone, and then I'm here completely alone with having to be isolated from my children who had come from New York and California to be with us, but they couldn't really be with us and they couldn't be there as a family. They were very supportive on the phone, FaceTime. So technology allows you to be together in all of this. But I think the biggest challenge was one is the unknown, and two is the isolation.
Yeah. So tell us a little bit about your kids, adult children, and how they manage. We're starting to get some questions too, so I want to pay attention to that. But so beyond FaceTime, was there any other way of interacting? No, probably not.
So, I was also quarantined at home because I was COVID positive, and I got tested the day I brought Jack to the hospital. So I hadn't tested before that. So me being COVID positive, at that time, I self-isolated. So the kids did come and help us with grocery shopping. So I used to see them through the window. They used to drop off groceries on the front porch. And we are fortunate that we have Jack's parents live in Massachusetts as well. So we have a house, and the kids actually stayed in the house, and we were very connected through all of this without necessarily seeing each other in person.
Second best thing. I'm going to toss some questions to you from the chat and from the questions and answers pane. And since we're speaking of uncertainty, one person asks, I know this uncertainty is hard as a physician. Could you sense the discomfort with the uncertainty from your doctors?
Yes.
And what was that like for you?
Yeah, no, absolutely, absolutely. I think I had a phenomenal crew of clinicians, both doctors and nurses looking after me. And I think that's what got me through and gave me the strength, because as much as I was connected with my family through FaceTime, it's a siloed life you have out there by yourself. So in terms of the uncertainty, I think there was a fair amount of uncertainty as to what my laboratory results kept meaning also, because my cytokines or my CRP, ESR, LDH were all trending in the wrong direction, although at times I was feeling a little better. There were always questions coming up as to what the next best thing could be from this, or what is this leading towards, or whether we should change treatment strategies. I think there was a fair amount of uncertainty as to what the long-term sequelae of my lungs is going to land up being after I had this infiltrative process going on. I think those questions still remain, and there's still a fair amount of uncertainty related to what the long-term impact of this of the COVID illness is going to be on people. But I think even the day-to-day decisions regarding the use of NSAIDs, at home, we were trying to keep me off NSAIDs because there was literature that, ibuprofen could be detrimental. The same kind of played into my hospital stay. And even when I felt ill, we were trying to stay off NSAIDs as much as possible. And then I would get a teeny weeny bit of indomethacin at night when I really needed it to kind of help me go to sleep because of the fever and the discomfort. So I think there were a lot of things that were evolving. And I think many of those questions have been answered now, at least how to treat patients acutely. So that's an example of the uncertainty, I would say, just on a day-to-day basis.
I will just add out there, Beth, is, because we were physicians, obviously our physician colleagues and our nursing colleagues kept us really well informed, but to the point where at times you really don't want to know as a patient, especially around the uncertainty. And they were doing it in good faith, good conscience, but it can be, you're looking to your physician at that time for confidence. And I don't think there was a lot of that around, and that was purely because we just didn't know how to deal with it.
Yeah, which is really, it's disconcerting. It's disconcerting for everybody when you don't know how this is going to unfold. And to that point, we have a really interesting question about, talking about uncertainty, since there's a growing number of people who are now experiencing COVID-19 as a chronic illness, how do you think things are going to change for those people? Do we see course, we don't know, we can't predict the future, how this will ultimately unfold for people who don't resolve their symptoms as well. But how do you think healthcare might change with the growing number of people who may actually have chronic sequelae from it?
Yeah, that's a good question. And, I must admit that mine is an N of one. So I have personal experience to share, and I've done really well. I can tell you that after I got out of the hospital, I could barely climb, half a flight of stairs, and I would get short of breath. And my office in the Gray Bigelow building at Mass General is on the 8th floor, and I routinely always climb 8 floors and never take the elevators. And I could not even do half a floor when I tried, when I started coming back to work. And this was about at least 2 months out. Now I'm back to 100%. I mean, I can do the 8 floors. My lungs have recovered completely. I'm not short of breath with moderate to severe exercise. But I didn't think I was going to reach that spot, because since it carried on for about 2.5 months after my fevers had abated, I thought that I was left with some long-term scarring out there, and that I'd just have to live with a reduced exercise capacity. Having said that, I think when you look at the literature and you look at, case reports, there's a wide variability of response. There are people who are mildly affected, there are some who are moderately affected, and there are some who are severely affected. I think the ones who get on ventilators and have significant scarring take a much longer time to recover, and some may not recover completely. And I think those studies are still, in terms of long-term follow-up, are still waiting to be done, because if you look at it, this has been just around since the last 3.5 months. So we really don't have any long-term data. And even for the ones who recovered, I mean, are there going to be some long-term immunological responses that could, cause you to have a second relapse or so? And I don't know the answer to that.
Yeah, for sure. Do you have anything else, Noopur, that you wanted to add to that? It's all open,
Yeah, no, I agree completely with Jag. And, you hear more and more stories of younger people being impacted, people with symptoms which weren't necessarily described early on, Beth. And I think it's important for people to understand that this is serious. Until we have effective treatments for something like this, in the majority of patients, it may be a mild or a moderate illness, but when it affects people severely, and it can affect the young ones, it's not just for the old folks. These are sort of the take homes I would, people need to understand that. We need to protect each other, and we've got to do this together. And we really need to have a unified strategy on trying to address this disease until we get an effective treatment strategy or a vaccine in place. Jag and I have were COVID positive for about, was it 8 weeks or 8 or 9 weeks? He did mount a nice antibody response. I was COVID positive the entire 8 weeks, and I have 0 antibody response. So everybody reacts so differently, and we're still learning about this disease. So be careful, take it seriously, and I think put in place simple measures of one-on-one infection control.
Yeah, it raises so many more questions. Does that mean that, you could actually be reinfected, or if your antibody, if you're still COVID positive, then what does that mean? I think, there's information out there that you stop shedding infectious virus after a certain period of time, but I think there's still a lot we don't know. More questions are coming in, so I'm going to toss these over to you. And this, again, people are really interested in this issue of uncertainty and shared decision-making and the involvement of clinicians when they themselves are patients, and the involvement of family. And one person's asking, what keeps physicians from asking patients, well, this is on the other side of it, if and how they want to participate in medical decision-making, particularly when the patient is a healthcare professional. What keeps physicians from asking healthcare professional/patients how much they want to participate in medical decision-making? That's the question.
That's an interesting question. I think probably a lot of that also depends on what your relationship with that healthcare professional is. You know, how senior, junior they are, what specialty they're engaged and involved in. For example, if I was an infectious disease clinician and I was looking after a healthcare professional who was in the infectious disease department, my whole interaction would be different from somebody who was not involved in that specialty. Having said that, I think it's a fair question to ask whether you want to be involved in the decision-making process or not. I think it's almost presumed that you would want to know what's going on, which I think we feel even when we're not looking after a healthcare professional, we feel that we need to tell our patients as much as we can in a way that they'll understand everything that we're doing and make everything that we do anyway a shared decision-making strategy, and it's not paternalistic anymore. So I think the same applies even when you're dealing with a healthcare physician, that you're inclined to share the information. You don't have to ask them for what they would like to do, but I think you're certainly, and because, and if they do have an opinion on what they'd like to do, I think you can incorporate it in your plan and have a discussion with him or her.
Yeah, absolutely. Do you want to add, Noopur?
No, I agree completely. Both of us take care of a lot of physicians as patients as well. So that's part of what we do. And, I think Jag is absolutely right. I think it's not only for physicians, to be honest, it's for everybody. Shared decision-making is a part of how we practice medicine. I think educating a patient is probably the most empowering thing that you can do for a patient, and allowing a patient to be a part of the decision-making. I take care of a cancer wherein I get to know my patients over years. So patients to me are my family. It's an extended family, and no decision is made without having them be a part of that decision-making. And it's not just the patient, it's the patient's family. Now, this was a very different experience. Here you are acutely ill, you are hospitalized for a week, and you meet a whole lot of different specialties walking in and out. You have cardiology, you have infectious diseases, you have the critical care experts. So it's a very different way of dealing with this in an acute care situation where you don't have that long-term relationship. But I think even there, involving a patient and a family, and I will tell you this, Beth, MGH has been a big part of how we took care of COVID patients. I think the biggest issue was isolating the patients, but as clinicians taking care of COVID-19 patients, when it came to really difficult decisions with end-of-life decision-making, which was a lot of it was a part of this COVID-19 treatment, we did include patients in those or relatives, and we FaceTimed. It was very different from when you do it in person with a person sitting next to you. And I think those conversations were probably the most difficult for us as clinicians when we had to do it with our patients. But we got patients on Zoom. We got the relatives on Zoom and tried to have those extremely difficult conversations, which I think was probably one of the most challenging parts of what we've done during this COVID era.
Yeah, very, very difficult. We've heard so many stories, especially during Schwartz rounds, of the pain that has involved and entailed for so many people. There is a question related to this, which is about, based on your experience with COVID, what have you learned about sharing bad news or just admissions of uncertainty with patients and families? Have you changed your practice because of your experiences with this?
Well, that's a tough question to answer. I will say this, that my experience with COVID-19 certainly made me realize that medicine is entirely a team sport. It does not run off just one clinician. I can tell you most of my care was from the nursing staff. But I was as excited to see the catering folks as well as the cleaning folks who were all involved in my care. And it runs like clockwork. And I think it's important for us to recognize that it's just not the physician who's walking in for 30 seconds of the day. I mean, it was much longer than that, but I'm just giving you an analogy of what happens oftentimes in day-to-day practice, that there is so much more behind the scenes that is going on for the patient experience and for the patient getting better that oftentimes we don't pay attention to. That is something that I think I experienced firsthand, and I've taken back with me. You know, sometimes many of us proceduralists can be a little narcissistic. We think kind of the world revolves around us. I know for certain that we have a really tiny role to play because we were a non-essential service during COVID.
There's a reckoning, right?
There you go. Exactly. And on top of that, just looking at, you know, how much it takes to take care of you in an institution or in a hospital, I think was eye-opening for me and certainly changed the way I look at day-to-day clinical practice now.
So people are asking here in this box here about what was the most helpful or supportive interaction you had with any hospital worker, clinical or not, right to your point about, you know, the importance of people cleaning the room and, you know, everything else. So do you have a particular interaction that you recall, or you, Noopur, you know, from your point of view?
Yeah, so, you know, I'll just add a little bit to what Jack talked about, uncertainty. You know, uncertainty is something which we're not used to in medicine. We are the kinds of people who like to go in and fix things all the time. I work in an area which is oncology, which has plenty of uncertainty, so we're used to that somewhat. But I do think having that uncertainty is a really humbling experience, and it is something which grounds you. It's something wherein I think the biggest thing for me was don't take things for granted. And when there is uncertainty, I think it's so important to remain as transparent as possible, because patients get it. And us telling patients, hey, I just don't know which way things are going to go, but I'm going to be there with you through thick and thin, is the most important thing that you can leave with a patient. For me, I think the experience that I had, so Jag was actually admitted to the floor that I work on. So London 9 was where he was hospitalized. The oncology floor had become a COVID-19 floor. So I knew the nursing really well. And I can tell you how supportive they were. I used to get text messages from the nurses because I couldn't see Jack. They used to see him and text me and send me smiley faces and not smiley. He's doing fine. Don't worry. We are watching over him, so you don't have to think about it at all. And that to me was probably the most reassuring thing that I went through, going through what we had to.
It's incredible. So there was informal and sort of peer support really for you because you work there. I just wonder about other considerations and whether or not there was formal support from mental health workers, social workers, anybody else to discuss fears or other types of concerns.
No, I don't, there wasn't, I mean, I didn't have any concerns from that perspective. I don't think I needed any support, and it wasn't given. I think just being able to communicate with the family was all the mental support I needed. And then obviously the nursing staff was fantastic. And the clinicians were fantastic, you know, so I think everybody who participated on a day-to-day basis in my care were the support that I needed. And I don't think I needed anything beyond that. But I'm sure it's available for folks who need it.
Yeah.
I think we're really fortunate because, you know, we're a close-knit family. Beth, the kids were amazing. I couldn't have done, or I couldn't have gone through what we did without having Ashin and Ahana out there, who were so upbeat throughout all of this, despite knowing how badly Dad was doing. The other thing which my kids really took upon themselves was I was not communicating with the family, and they were the kind of communicators with the rest of the family, because everybody was worried. Jack's parents, my sister, my mom, and when you have too many questions asked, you at a point don't want to answer them and don't want to be the point person. And my kids took it upon themselves to sort of be the point people for this. So that was really helpful for us as a family. I don't think we needed a lot of emotional support because we were able to provide it to each other. But there are lots of resources in the hospital, and not everybody is as fortunate. And if people need that support, it is available, and people have gone out of the way. We have our oncology psychiatrists have been able to provide a lot of the support to our staff. Also, we've been able to provide help for folks who needed help to de-stress, etc. So the resources are very much there.
Yeah, yeah. I think it varies across the country, surely, depending on how well resourced the hospital and the other facilities might be. I wonder if you can just talk a little bit more, Jag, about your recovery and um, your thinking. I remember you reflecting how fragile life can be at times. And I wonder if you can just sort of think out loud with us about your thinking on that and how it's evolved even since March.
Sure. No, thanks for that, Beth. So, I think every cloud has a silver lining, and I think the silver lining with COVID has been that it's given us, I think all of us, an opportunity to press the pause button, because life has gotten a little slower because of that, and it's given us time to kind of reflect on a lot of things that impact our life on a day-to-day basis. During my period of illness, obviously, I recognized how fragile life is. I recognized, I waited for, the nurse or the cleaning person or the caterers to kind of swing by the room so I could actually have a conversation. I remember thinking how privileged it is to actually be able to communicate and have a conversation, and not take that for granted, because, who knows when you may not be able to do that anymore. So I recognized the privilege of being able to communicate, and then it gave me time to reflect and put life in its perspective in terms of what really is important for me. I mean, how am I going to balance life here onwards? How do I look at success versus satisfaction versus fulfillment? How do I balance those? So it gave me a fair opportunity to kind of reflect on those aspects and issues. And then, like I said, it things that I had not considered as important, the folks around me on a day-to-day basis in my rounds and who are involved in my patient care, it became more important to me than ever before. And also made me realize also how important it is to recognize the value of family and friends, and oftentimes you take much of that for granted in your journey because you're so fast-paced in your living. So I think the pause button gave me the opportunity to reflect on multiple fronts, and I'm still reflecting.
Yeah, absolutely. And I think you're in a different position having had the acute illness, but I do think that a lot of people are thinking about this right now, because so much has paused, life as we know it has paused, so I think it's maybe we'll find our way to different ways of thinking about what's really important to us, what we truly value, how to walk our values. How about you, Noopur? Did you take some time to really think about this? And just curious if you had done the same kind of reflection.
I had a lot of thinking time, Beth.
I'm sure. Much more than you want.
No, absolutely. When you go through something like this, which is so close to, you're faced with your own mortality. which you don't expect to be faced with, especially when you're otherwise healthy. It really puts life into perspective. It puts things which are important into perspective, and it puts so many things into perspective. Your relationships, where you should be spending your time, where you should be spending your energy, and what it is that you should be prioritizing. So I do think re it almost reboots you, so to
Yeah.
speak, and it's a good thing to think through. It gives you the time to reflect and think through those things, which it has allowed, I think, both of us to do. I think we're so grateful for the outcome, which could have been very different, but we're thankful for the way things worked out. And to both of us, I think, both Jag and I, um, the one thing which we um, wanted to continue to do, and we've been very public about this whole experience, is there is a certain sort of, people are afraid of this. People have somewhat of a stigma associated with this. And I think educating people and allowing people to be a part of this experience is something we felt extremely strongly about, because there's so little known. And if we can try and um, put this into some kind of perspective and be helpful to other people who are going through this, I think was something we both felt very, uh, we felt passionate about doing, and that's part of the reason for sharing this. So um, I think we've learned a lot, and I still think we have a lot more to do in terms of education, as you can tell by what's going on in the country right now. And, I do feel that we need to continue to speak up and continue to educate people if we can.
Can you say more about the stigma, Noopur? It's not uncommon for people who contract a serious illness to then be shunned, or, for people to avoid them. And have you seen this? Have you had experiences of this?
So yeah, so, when it's an infection, so when you're COVID positive, for example, the first thing you think about, because it's an infectious disease, are people going to look at you differently? Are people going to treat you differently? I know colleagues, even today, Beth, who've never been public about them being COVID positive, and they've not wanted to share that information. And that's a personal choice, and that's okay to do. But I do think there may be some element of that, and there should not need to be that. It happens to anybody, it happens to everybody, and the more we talk about it, share it, and the more we do things about it, I think the better it's going to be for people. We need to protect each other, and I feel really strongly about this, specifically because of what I went through. I was completely asymptomatic and yet COVID positive. And if I didn't know, I would be spreading the virus just as much, right? And so for us to acknowledge that it exists, for us to acknowledge that it can happen to anybody and everybody, and for us to acknowledge that we could be the ones who are carriers, I think is really, really important for all of us to understand and appreciate, and actually educate people about.
That's really interesting. It's also true that there is stigma around asking for help if you're feeling stressed, particularly amongst the healthcare workforce. I just wonder, what you're seeing now in terms of the stress levels of your colleagues. Jag, what about you? Have you been seeing this? I know it's very, very prominent.
Yeah, no, absolutely. I think, what Noopur said is spot on. Just being transparent about it has actually, I think, helped a lot of other healthcare workers who have contracted COVID. And it's interesting, nobody wants to talk about it openly, but they will come and knock on our door and chat with us, because now they feel suddenly that they have a place that they can be open about, and they effervesce, within our little confined space. So I think, there is something to be said about being transparent, and there's something to be said about not having a stigma attached to it. Because I think, it's going to continue for the next year and a half, 2 years at least, and many unsuspecting individuals will probably contract it along the way. And the more we accept it as a part of our lives and learn to figure out how to live with it, I think the more important it is. But there is a fair amount of stress amongst healthcare workers about, either getting it and trying their best not to get it.
Yeah, for certain we're seeing that from the Schwartz Center's point of view. It's a very, very prominent, the fear and the angst over worrying you might bring it home to your loved ones or spread it to other patients or other people is just so profound, such a source of distress. There was another question here about how has treating COVID, this is a big question, reorganized the hospital. And of course, this is going to be very particular to the hospital you both are in. What are the changes that might be lasting? And do you see this, any changes that you've seen locally, do you see these happening elsewhere?
Sure, happy to take that on. So, I think because of the illness and the, I would say, aggressiveness with which it was existing out here, there were a lot of changes in the hospital to free up folks to redeploy them and repurpose them. But at the same time, it is significantly changed how we interact and interface with our patients also, because we didn't want many patients coming to the hospital and having the risk of potentially getting infected. So a lot of medicine, the way it's being practiced right now, has converted to the arena of telemedicine or telehealth. There's a lot of virtual care, and it's gone up by almost 80 to 90% in most institutions. And I think much of the care we give in the future will be telemedicine. I think it will not substitute or replace conventional in-person care, but it will be complementary, but will be used more often than it has been in the past. Mm-hmm. So that's one permanent form of care that I think will be long lasting. I think beyond that, digital care itself overall will become the foundation of how care is delivered in the future. I think there will be an evolution of sensor technology that will allow us to better monitor our patients over FaceTime or over Zoom or whatever modality we have for telehealth, so that we can follow them more objectively. I think along with this, there will be some changing job descriptions, and I'm not going to get into the details of them. I think people will get redeployed and repurposed based on the needs, and many of these needs will be to really expand the digital footprint. I think the beauty of the strategy also is that it might help uplift some of the disenfranchised folks who were not getting good care in the past. And now if we're really reinventing ourselves using telemedicine, it's a huge opportunity to ensure that there's more health equity, because that, again, I think all of us have realized during the COVID pandemic is a big issue in the country. So I think there are some long-lasting changes. Most of them are in the digital form of care. I think a lot of remote monitoring also will become center stage.
Yeah. Thanks, Jed. What about you, Noopur? What do you see in your field? I'm curious about that.
Yeah, so I think we're doing the same. I think there's going to be more decentralization of care. We're going to look towards more community-based care, and we as a cancer center are already working towards that goal. As Jag has pointed out, digital health is going to be a big part of how we provide care. The other piece is, being an oncologist, cancer is not a non-essential service. We continue to treat patients. And what we've learned very quickly in the cancer centers, COVID or no COVID, we still take care of our patients. And we've been able to do that, wherein we've been able to triage patients. And the other important thing to remember is COVID does not decide on who to infect versus not. So we have a lot of COVID positive cancer patients as well. And cancer patients specifically are immunocompromised patients who are at a higher risk. And what we as a cancer center have done is kept open, but have had different approaches. So for COVID-19, positive cancer patients, we have a different triage area. We have a different space for treating them. And we've had to try and make all of these adjustments, which we have done over the last 3 months or so. So we continuing care, but having to cater for both sort of populations.
Yeah, I guess I have mixed feelings about it. I agree. Actually, I'm not sure about this, Jag, but I always thought that telehealth would certainly increase access. And then now reading about how students are suffering because they don't have the internet, they don't have iPads, they don't have devices, they don't have, little iPhones, especially in the inner cities or with underrepresented, somewhat marginalized populations. I wonder if it really will deliver on its promise. I hope so. But also, I guess since I'm a in-person kind of a doc, I can't help but wonder, oh my goodness, what will this really be like? The need to touch, to hold, to, all of those things. It's hard to replace all of that, I have to say. We're going to wrap up, in a few seconds. I wanted to just ask this one last question, which is, where do you find hope and inspiration today, right now, as we're ending this conversation? We'll sort of think about that.
Sure. I was going to say I find it in Noopur, but which
That's right.
Beyond that, I think it's really amazing to see how hospitals, and especially the hospital we work in, and I'm sure all the hospital and institutions across the country and the healthcare workers across the country have rallied, have adapted to the situation, repurposed themselves, and been able to deliver phenomenal care to really vast amounts of sick patients out there. So I take a lot of hope from that. And I do feel that, at some point in time, we're going to have to reverse engineer and figure out how we actually did all that, and then try to hardwire it into our future activities.
Right.
Because that's been unparalleled. So that's how, I would kind of close with saying, just get inspiration from my colleagues and folks around me who've given their lives looking after really sick patients, and literally given their lives looking after sick patients.
Yeah. It is inspirational and sad at the same time. And it's just been remarkable how quickly people have changed, adapted, moved forward. What about you, Noopur? What are your sources?
Yeah, no, I think, everything that the healthcare workers have done has been really inspiring. But I, at the same time, think it's a very hopeful time, Beth, because we've been able to, it took us a virus to make all the changes that we've done in the healthcare system. And these changes were meant to happen in any case. And they've happened really, we've had to do them very quickly, almost overnight. And we've done that really well. I think what's really other piece, which is really hopeful, is we've had all different specialties come together in this COVID era, and research has really taken off. And the number of studies we've started doing in the last 3 months very, very quickly to try and answer critical questions to take better care of patients has been remarkable. So I am extremely hopeful that, if this is what it took us to all come together and work together, imagine what we can do without having a virus on board. So hopefully next year we'll be better off.
Right, without a crisis would be ever so much better. Well, I want to thank both of you so very, very much. We appreciate your time and your insights, and thanks to the audience for participating, for your questions. We will be putting out a recap of this session, and it's going to contain a link to get your continuing education credits. But we look forward to having you all back on Tuesday. We're going to have a really interesting session, Current Forces in the next chapter of the long story of immigration. It's going to be a panel presentation led by Dr. Fernando Stein, who's the Associate Chief of Critical Care at Texas Children's Hospital. He's also the past president of the American Academy of Pediatrics. We hope you will join us, and we thank you both again so very, very much, and thank you to our wonderful audience, and have a lovely, lovely weekend.
Great. Thank you so much, Beth.
Thank
Take
you.
care.
Thank
Bye-bye.
you. Bye.